Okay, welcome to this deep dive. We've got some really fascinating source material today. We're digging into something that's incredibly relevant to, well, all of us, our health information.
That's right. It impacts everyone.
Think about it, your last visit to the doctor. You share how you're feeling, the doctor checks you over, maybe orders a test, writes a prescription.
Yep, the usual routine.
Well, every single piece of that interaction, every detail, it gets documented. Now, picture that happening millions, truly millions of times every single day.
Across clinics, hospitals, everywhere.
All this incredibly rich, detailed health information is being captured and stored, mostly within electronic health records, EHRs.
Right. EHR.
Now, traditionally, and our sources really emphasize this, EHRs were built first and foremost to support your individual care.
Exactly. To help your doctor, make sure they have your history, support their decisions for you, continuity of care, billing, workflow, that kind of thing.
And they do that crucial job. But here's where the perspective in our sources, well, it shifts. And this is where it gets really interesting.
Yeah, this is the key insight. That same data, if you sort of zoom out from the individual chart and look across millions of them,
Aggregated, carefully de-identified, analyzed responsibly.
it becomes something completely different. Our sources actually call it a public health goldmine.
A gold mine. I like that. It's taking all these little fragments of individual health stories and seeing them as pieces of a much bigger picture, right?
Exactly. A picture of the health of entire communities, maybe even the whole country. The potential is, well, it's huge.
Detecting outbreaks way faster than before, spotting disease trends we might otherwise miss, uncovering and maybe starting to fix these deep health inequities.
And ultimately, just building a healthier society by learning from this data.
But of course, it's not that simple, is it?
Uh,
Unlocking this potential isn't like flipping a switch.
No, definitely not. The sources are very clear about the hurdles. Huge hurdles.
Like the data often being stuck in different systems that don't talk to each other.
That's a big one. Interoperability. Plus, you have absolutely critical concerns about privacy and security. That's paramount.
And the quality of the data itself.
Yeah.
Collected for one purpose, maybe not perfect for another.
Right. Data quality, completeness.
Yeah.
It all matters.
So the mission for this deep dive, then, is to explore how we bridge that gap.
Yeah.
How do we take this data, generated for patient care, and responsibly use its power for, well, everyone's health?
We'll look at the potential, face the challenges, and explore the solutions the sources point to.
Okay, let's start with the basics then. What exactly are we talking about with EHRs? Our sources say digital patient charts, but it sounds like they're more than that.
They really are. That definition's a bit basic. They're far more dynamic, much more comprehensive now.
Right. So much more than just scanned documents. What kind of information are we talking about? The sources list quite a bit.
Oh, yeah. A vast amount of detailed real-world info. You've got the basics like demographics, age, sex, location, sometimes ethnicity.
The medical history, past illnesses, surgeries, family history, all that background.
Crucially, diagnoses. And these are often coded using standard systems like ICD-10. That coding is really key for pulling the data together later.
Makes sense for analysis. What else?
Medications are tracked in detail, not just the name, but dosage, frequency, any allergies linked to them,
Lab results too, I assume. Blood tests, imaging.
everything. Blood work, pathology reports, imaging findings, it's all logged. Then you have clinical notes.
The doctors' and nurses' narratives. Probably full of rich detail.
Incredibly rich, yeah. But also challenging because it's unstructured text, harder for computers to parse automatically.
Gotcha. Immunization records.
Yep, those are in there. And increasingly, we're seeing things like lifestyle factors, smoking status, for example, and even data related to social determinants of health.
Things like housing status or food security, factors outside the clinic.
Exactly. Information that gives context to a person's health. So it's this incredibly detailed snapshot of someone's health journey, captured right there in the midst of clinical practice.
And as you said, originally designed, focused squarely on that individual patient, making sure the doctor has what they need for that encounter.
Right. Helping providers communicate, streamlining prescriptions, making workflows smoother. They serve that direct care purpose pretty well.
But the shift our sources highlight is looking beyond that single patient. It's seeing this huge pool of real-world clinical data as, well, a collective asset.
A resource, yeah.
Yeah.
Each record is just one fragment, but bring millions together, and you start seeing patterns, trends, stories about community health you just couldn't see before.
And that's the public health goldmine idea again. When you aggregate it, Carefully strip out identifying information and analyze it properly. Boom.
It becomes this powerful engine for public health insights and hopefully action.
Absolutely. Let's dive into some of those specific capabilities our sources talk about. One big one is enhanced disease surveillance and outbreak detection.
Yeah, this is a major one, especially relevant nowadays.
Traditional surveillance, that often relies on doctors or labs reporting confirmed cases, right?
Yeah.
And there can be a lag.
Exactly, a time lag. That's where EHR data can really make a difference. It offers potentially much earlier warning signals.
How much earlier are we talking?
Sometimes days, maybe even weeks before those traditional reports filter through. Our sources describe how public health can scan this anonymized data looking for, say, unusual spikes in symptom clusters.
Like what kind of clusters?
Maybe a sudden surge in patients showing up with cough and fever in a specific area, a particular zip code. That's syndromic surveillance.
Syndromic surveillance. So you're spotting trouble, potentially, before you even have a confirmed diagnosis for what it is.
Precisely. Or you might scan for sudden jumps in diagnostic codes for, say, respiratory illnesses, or notice weird patterns in lab results across a whole region.
And this helps catch outbreaks sooner. Flu, food poisoning, maybe even new viruses.
Much sooner. That early detection is gold for public health response. It means targeted investigations can start faster, resources deployed quicker, health messages get out to the public in a timely way.
Makes sense. And beyond outbreaks.
Oh, it's invaluable for tracking known diseases too, prevalence, incidence, monitoring things like vaccination rates in a community, or seeing if public health campaigns are actually having an impact on the ground.
Okay, so faster detection for immediate threats. What about the longer-term picture of health?
Right, that leads us to population health management and chronic disease monitoring. Think about the huge burden of chronic conditions, diabetes, heart disease, hypertension.
They affect so many people.
Exactly. Aggregated EHR data gives us this powerful lens to understand the true scale of these diseases within specific communities or demographic groups. It helps pinpoint who's most affected, where the needs are greatest.
So it really maps out the landscape of chronic illness in fine detail.
Yes, and it helps identify common risk factors driving those illnesses in those populations. Crucially, it lets public health and health systems track adherence to clinical guidelines at a population level.
What do you mean by that?
Well, take diabetes, for example. Are patients in a certain area actually getting the recommended regular A1C tests? Are they getting their eye exams? The data can show if that recommended care is happening consistently or if there are significant gaps.
And you could potentially track if interventions are working, say a community program promoting healthy eating. Could you see if that impacted BMI or blood pressure in local EHRs?
That's the idea, evaluating the real-world impact of public health efforts. It allows for much more targeted strategies tailored to the specific needs of subgroups you identify in the data.
Now, this next one feels incredibly important, identifying health disparities and social determinants of health. The sources suggest this is one of the most powerful uses.
It really is, potentially transformative. By linking this de-identified EHR data with other information, like geography maybe down to the census tract level or socioeconomic data,
You can start to visualize health inequities much more clearly.
with a clarity that was often missing before. The sources give some stark examples, like finding significantly higher rates of childhood asthma attacks in neighborhoods known to have poor air quality.
Or seeing differences in outcomes for certain groups.
Yeah, observing if maybe people from certain racial or ethnic backgrounds experience delays in cancer diagnoses or have poor treatment outcomes, even when they're supposedly using the same healthcare system.
Wow. So it connects the dots between what happens inside the clinic, the diagnosis, the lab result, and the realities outside the clinic walls.
It makes those connections visible in the data. And identifying those patterns, that's the essential first step, isn't it? Towards developing targeted programs, policies that address the root causes.
Working towards actual health equity, directing resources where they're most needed, seeing the impact of social factors on health.
Exactly. And finally, the sources talk about using this aggregated EHR data for evidence generation, for policy and research. This massive pool of data is basically real-world data, or RWD.
Right, RWD. And that generates real-world evidence, RWE.
Precisely. This is hugely valuable because it complements traditional clinical trials. It shows how diseases actually progress, how treatments actually perform in the real world with diverse patients, not just the carefully selected people in a trial.
So it's good for comparing treatments, seeing what works best in day-to-day practice.
Very much so. Comparative effectiveness research. And you can also evaluate the impact of broader health policies.
Like, did a city's smoking ban actually correlate with fewer smoking-related diagnoses appearing in local EHRs over time?
Exactly that kind of question. It creates this feedback loop. The healthcare system, public health, they can continuously learn from the data generated during routine care, helping build a smarter, more effective system for everyone.
So the potential is just immense. Faster detection, better chronic disease management for whole populations, shining a light on inequality, building better evidence. But as we said, our sources are realistic. It's not easy.
Not at all. It's complex. There are significant challenges detailed in the sources.
And probably the biggest one, the one that gets the most focus, is data privacy and security.
Absolutely. Top of the list, and rightly so. This data is incredibly sensitive personal information. Protecting that privacy is, well, it's non-negotiable.
Totally.
The sources stress the need for really robust methods to de-identify or anonymize the data before it gets used for these broader public health analyses. But they also acknowledge perfect anonymization is really, really hard.
Especially with such rich data. Could pieces potentially be linked back?
There's always a theoretical risk, especially when you combine data sets. So it's this constant balancing act, isn't it? Maximizing the public good you can get from the data while rigorously, absolutely safeguarding individual privacy.
Which means strict rules like HIPAA or GDPR, but also ongoing ethical debates and technical work.
Constant vigilance and innovation are required. Then beyond privacy, you've got that big technical headache, interoperability and data fragmentation.
This is the systems not talking to each other problem.
That's it. Different hospitals, different clinics often use EHR systems from different companies. Historically, these systems just weren't built to share data easily. They speak different digital languages, essentially.
Like trying to connect incompatible plugs from different countries.
Good analogy. It results in data silos. A patient's full health record might be split across several disconnected systems. Getting a complete picture is tough, both for their own care and for pulling data together for population analysis.
And then there's the quality of the data itself. Data quality and completeness.
Yes, the classic garbage in, garbage out principle.
Right. If the data going in isn't accurate or complete,
Then the insights coming out won't be reliable. You run into issues like missing data fields, simple typos, or entry errors, maybe different doctors recording the same thing in slightly different ways.
and the fact that the data was primarily gathered for clinical care or billing, maybe not with public health questions in mind.
Exactly. So crucial details needed for public health analysis might be missing or recorded inconsistently.
So you need efforts to improve data entry and better ways to clean and standardize the data afterwards.
Yes, it requires work on both ends. Improving quality at the source and developing sophisticated methods for cleaning, validating, and standardizing it before analysis.
Okay, so these challenges, privacy, interoperability, quality, they're real, they're significant. But the sources also say they're not impossible to overcome.
Definitely not insurmountable. They point to several solutions and innovations that are making real progress.
What are some of those key developments helping us navigate this?
Well, a huge one is the push for standardization initiatives. There's a lot of work going into common data models, common terminologies, so systems can understand each other.
Like a universal language for health data?
Sort of. Our sources specifically mention FHIR, that's FHIR, Fast Healthcare Interoperability Resources. It's a really important standard that's acting like a universal translator, making it much easier for different systems to exchange and interpret health data meaningfully.
It sounds like it could genuinely break down some of those data silos.
It's making a big difference. Another key development is creating trusted data environments.
What are those exactly?
Think of them as highly secure, governed platforms, sometimes called beta enclaves. Sensitive data goes in, and researchers can run analyses inside this controlled space, but they typically can't download or remove the raw data itself.
So it minimizes the risk of data getting out while still allowing analysis.
Precisely. A way to manage privacy risk while enabling research.
Okay. And what about technology like AI and machine learning? We hear so much about AI these days.
Right, AI and ML are definitely part of the picture. The sources mention them as powerful tools, interestingly, not just for the final analysis, but critically for preparing the data first.
How so?
Well, as of now, 2025, AI is being used quite effectively to help clean up messy EHR data, normalize it. It can use natural language processing, NLP, to extract structured information from those free text clinical notes we talked about.
Pulling useful bits out of the doctor's narratives.
Exactly. And AI can help intelligently estimate or fill in missing data points based on patterns it learns. It can even help spot potential biases in how data was collected in the first place.
So AI is helping tackle the data quality and completeness issues, making the data more usable.
Among other things, yes. The sources also emphasize the ongoing evolution of policy and governance.
The rules of the road.
Basically, yes. Refining the legal and ethical frameworks around how health data can be shared and used responsibly while always protecting patient rights. This means clearer guidelines, thinking through consent models, establishing strong oversight.
So it's not just about the tech, it's about building trust and having clear rules.
Absolutely critical. Trust is foundational. And finally, public-private partnerships are proving really essential.
Different groups working together.
Yeah, growing collaboration between the healthcare systems who hold the data, the public health agencies who need the insights, academic researchers developing methods, and the tech companies building the tools. Bringing everyone to the table is key to making this work effectively and sustainably.
Okay, so stepping back from this deep dive, we've kind of journeyed from picturing that single doctor's visit, that one patient record,
To understanding how that record, combined with millions upon millions of others, holds this potential to become a powerful engine for population health.
our sources are pretty clear that while the challenges are big privacy, systems talking to each other, data quality, they are being tackled through innovation, standardization, collaboration.
The hurdles are real, but so is the progress.
And the vision the sources describe is really compelling, isn't it? A future where public health is more proactive, maybe even predictive.
Where we can catch outbreaks earlier, target interventions more precisely, because we're constantly learning from all these real-world health experiences captured in EHRs.
It paints a picture of a future where individual care and community health aren't separate things, but deeply linked, part of a continuously learning health system.
Where every clinical encounter, used securely and ethically, contributes not just to that one person's well-being, but to the health of the whole community.
That's quite a powerful idea, taking knowledge from millions of individual experiences and channeling it back for the collective good.
It is. And as we wrap up our exploration of this EHR goldmine, maybe here's a final thought for you, the listener, to chew on.
Given this incredible potential for public health benefit, but also the absolute necessity of protecting your privacy, what does the responsible use of your health data for the greater public good actually mean to you?
What questions does that raise for you about how data gets used in your community or even nationally?
Something to think about long after this deep dive ends. Thanks for exploring this with us.